Scoliosis. The anatomy of the spine. The vertebral column consists of the primary curves and the secondary curves. The primary curves are formed by the thoracic and the sacrum region, which are also called as the kyphotic curves, and the secondary curves are formed by the cervical and the lumbar region, which are also called as the lordotic curves. Definition of scoliosis: it refers to the lateral deviation or the sideways curvature of the spine with a rotation of the vertebrae that is more than 10 degrees. Classification of scoliosis: it is classified into structural scoliosis and non-structural scoliosis. Under structural scoliosis, we have idiopathic, congenital, paralytic, and neuropathic. And under non-structural scoliosis, we have postural, compensatory, and sciatic. A mnemonic to remember structural scoliosis is IC pen. So I for idiopathic, C for congenital, PA for paralytic, and N for neuropathic. For unstructural scoliosis, you can remember pieces. So P for postural, C for compensatory, and S for sciatic scoliosis. So first one is the structural scoliosis. Under this we have idiopathic. In idiopathic, it is the most common type which is seen during infancy, childhood, or adolescence. However, the exact cause might not be known. Congenital scoliosis is seen because of any deformity of the vertebral bodies. For example, hemivertebrae. Hemivertebrae refers to when only one side or one half of the vertebrae grows. Next, we have neuropathic scoliosis. It is seen because of any diseases of the nervous system, for example, in cerebral palsy, also called as CP. Paralytic scoliosis is seen due to paralysis of the trunk muscles, especially seen in case of poliomyelitis, because in poliomyelitis, the polio virus, it affects the muscles. In non-structural scoliosis, we have postural scoliosis. It is usually seen in adolescent girls. The curve is convex and towards the left side, but it straightens out when the patient bends forward. Compensatory scoliosis is seen whenever the patient compensates for the lateral tilt of the pelvis. That is, whenever you see a person with a short leg or else in an antalgic type of a gait. Next, we have sciatic scoliosis. It is seen due to unilateral painful spasms of the paraspinal muscles. For example, in prolapsed intervertebral disc. IVD is also called as intervertebral disc. So sciatic or sciatica refers to when the patient complains of pain in the low back or in the gluteal region and it radiates either in one or both the legs. Clinical features of scoliosis: there's visible deformity, pain with long standing, neurological deficit due to interference of the spinal cord. Examination: you need to inspect for the shoulders and the iliac crest, palpate the spinous processes to determine the alignment. We have a special test over here which is also called as the Adams test or the Adams forward bend test, where you need to ask the patient to stand with both the knees and the feet together, bend forward as much as possible, and examine from both the sides and front for any rib asymmetry or rib hump, as can be seen in the picture. You can also determine the angle trunk rotation by making use of a scoliometer. Under radiological features, we have the first one is the Cobbs angle. It is the angle formed between the intersecting lines of the uppermost and the lowermost most displaced vertebrae. It determines the severity of the curve. Next, we have rhesus sign. It helps in determining the ossification of iliac apophysis with the spine. So the growth usually starts from the ASIS, also called as the anterior superior iliac spine, and progresses towards the posterior iliac spine. The importance of rhesus sign is that it indicates the possibility whether the curve is going to progress. Vertebral angle, also called as the rib angle of Mehta. It determines whether the curve is going to progress or not. It is the difference which is created between the angles made by the apical or the most laterally deviated vertebrae and its ribs. So let's look in the first picture. You need to draw a parallel line to the vertebrae. Secondly, you need to draw a perpendicular line to this vertebrae. That is the red line in this picture. Now let's come to the second picture. Over here, you need to draw another line, which is the blue line over here, passing through one rib, and the other line, which is the yellow line, which can be seen in the third picture, passing through the other side of the rib. So the difference between the concave and the convex angle will give you the rib vertebral angle. That is, the convex angle minus the concave angle will give you the rib vertebral angle or the rib angle of Mehta. This is the same thing how to calculate the rib vertebral angle. Next, we have the rotation of the vertebrae. This should be noted on the AP view or the anterior posterior view. That is, if the spinous process is shifted to one side or if there is any asymmetry of the pedicles seen. Fourth, if the deviation is greater than 90 degree, it can result in any cardiopulmonary problems. Warning signs. You need to check for scoliosis in boys because most of the time we tend to neglect scoliosis in boys as it is mostly seen in adolescent girls. Secondly, if it is painful. Thirdly, check if there are any severe large curves. Fourth, small heavy patches on the lower back. Fifth, younger the patient, worse is the prognosis. Treatment, that is a non-surgical treatment or the conservative management, includes we have the Milwaukee brace, the Boston brace, and we also have the Charleston brace. Remember that the Milwaukee brace is also called as the CTLSO, that is cervico-thoracolumbo-sacral orthosis. It has a chain bar and it also has a plastic pelvic girdle. Next, the Boston brace. It is based on the 3-point principle and it has a success rate of about 70%. Exercises which can be given in scoliosis. The first one is breathing exercises. You can give them diaphragmatic breathing, lateral coastal expansion, especially if the patient suffers from any cardiopulmonary problems, stretching on the concave side, and strengthening of the convex side. You can give them backward child pose. Alternate leg and head control can be given. Exercises on the Swiss ball, kinesiology taping techniques, and overhead pulleys. You can also give them cow stretch and cat stretch. Surgical procedure includes realignment of the vertebrae and spinal fusion.